But for us, we just do what we want to do. And we see that it's so indicative for us. So we see that it is wise for us to follow the counsel that's been given to us. Now, we love, this is the things that, and I'll start this out. We love what we love. And the thing about us is that we love to eat. We like to eat. Now, many times you see this. That's right. We just ate. You think about this. One of the types of foods or diets that we are very familiar with, and we call it soul cooking Southern style. And I don't know if you can see all this stuff, but we love this stuff. We can relate to this. We can relate to chicken and dumplings, smothered chicken, pig feet, pork roast. Well, as average, maybe not. But there was a time in our lives where that was a part of our day. Now, here's the interesting thing as well. When we talk about putting things in our body. Now, how many people are familiar with the term? Any English majors here? Anybody who's an English major? Okay, what is an oxymoron? Is what? Okay. So, here, let me give you an example of a nice oxymoron in the diet world. I'm on my way home today to clean my new batch of chitlins that I just bought. Really? Well, if you don't clean it, why are you eating? Too many times people say, I'm not getting caught up in that mess. But you eat it. So the fact of the matter is, we have to be careful of the things that we put in our bodies. Reason why I'm here is because I want to sound the alarm. According to the American Diabetics Association and the American Heart Association, African Americans are disproportionately affected by diabetes and heart disease. Of all African Americans aged 20 years and older have diabetes. Following the statistics, we see that we're 1.8 times more likely to have diabetes. We're almost 50% more likely to develop diabetic retinopathy. That's an eye issue. 2.5 to 5.5 times more likely to suffer from kidney disease. We have a lot of us that end up on kidney dialysis because of our condition. And then 2.5 times more likely to suffer from limb amputations. Now, the whole amputation thing, I have to talk a little bit about that. The company I work for actually develops devices that help to alleviate peripheral vascular disease. So the fact of the matter is, when people get limb amputations, it's only because their doctors are too lazy to follow through all the procedures to understand. Limb amputation should be the last resort in every situation, unless there's noted cell and tissue damage and loss. There are ways that if the person is notified ahead of time that your blood flow is not all that great, they can offset all that to prevent them from being in a situation where they require amputation. But that's a whole nother talk as well. So we see again that what makes us at a higher risk? Diabetes by race. We're 12.5 times more likely to get diabetes of all the demographics that are out there. Now, I find it also interesting. I don't know that recently on the news, they just said that there was a 49-year-old woman who was from Mississippi that was a news anchor, and she died from a heart attack. Anybody ever hear that story? Yeah. The thing is that what women don't know is that black women, that is the leading cause of death for black women. 59% of black women are subjected to cardiovascular disease. And most of them don't know it because they assume it's the men that are at risk. But we have to understand that this is what the education is all about. So that it's very tightly connected. And we see that between cardiac disease and heart disease, it's a very unique combination in these things. And I'll talk a little bit about. So let's talk a little bit about diabetes. Tell me about diabetes. Diabetes is a disease in which the body doesn't produce or make enough insulin. Are anybody familiar with the insulin? It's a hormone produced by the pancreas that turns sugar and other nutrients into energy. Now, a lot of people say, well, I'm just going to cut out my sugar. Well, if you cut out your sugar, you're going to die. You need sugar. We all need sugar. The way sugar is metabolized is the issue. And I'll talk a little bit about the difference between type 1 and type 2. I'm a type 1 diabetic, and I've heard people, and I even heard Adventists, good old Adventist folk telling me, you can reverse your type 1 diabetes. We'll have another discussion on that. But anyway, alpha cells in the pancreas of insulin, which is in your pancreas, secrete the hormone glucagon in response to low concentrations of glucose in the blood. Beta cells in the pancreas of insulin secrete a hormone insulin in response to high blood sugars in the blood. Over time, too much glucose in the blood damages your nerves and blood vessels. And all this is the reason, is the etiology which causes a lot of the diseases that you'll see that people deal with. With this particular progression of disease. So if you have diabetes, you're twice as likely to have heart disease. Did you know that? Or stroke. Why? Because of the vascular impact of all this. And so then there's someone that doesn't have diabetes. So in addition, damage to the blood vessels in the legs can result in poor circulation, increased risk of foot ulcers, and amputations. With damage of the blood vessels that supply blood to the kidneys can cause kidney failure. Now, let me just, like I said, I want to keep this very simple. If the doctor told you you're at a risk of a heart attack, if you go to the doctor and I'm going to go into all these tests in a minute, and they tell you, you better be careful, try to exercise more, watch your diet, but you're at risk. If you're at risk of a heart attack, you're also at risk for a stroke. If you're at risk for a stroke, you're also at risk for lower limb disease. Why? Because everything is the same. It's just different locations. The process of developing atherosclerosis can occur in your lower limbs, it can occur in your heart, or it can occur in vessels leading up to your brain. It's the same thing. It's just all different locations. So that's why you have to have a holistic approach. You're not just targeting one area because all the areas are impacted. So now let's talk a little bit about diabetes. There are two types of diabetes. It's called type 1 insulin dependent, which is me. There's type 2 non-insulin dependent, which actually is the most aggressive form of diabetes. People don't understand that, and I'll explain that in a minute. And then there's gestational diabetes, which is basically, it's the same thing, it's that it only presents in women that are pregnant, and usually it will go away once they have the baby. Now, the challenge of that is, and what the doctors sometimes don't tell you, that how many has dealt with gestational diabetes? Anybody here have dealt with that? Well, that's a good thing. Because most women that have gestational diabetes have a greater between a 30 to maybe 45% risk of developing diabetes later on down the line. So it's just an early presentation, and if your body reacts that way early, chances are it's going to react, it's going to transition down the road. So let's look at type 1 diabetes. This is me. Type 1 diabetes occurs when your immune system, the body system that fights infection, attacks and destroys the insulin-producing cells in your pancreas. So when people tell me that I'm going to reverse your type 1 diabetes, there's nothing to reverse. My body already destroyed my pancreas and the cells that produce the insulin cells and the receptor sites and all that stuff has been attacked. Now, they're doing research now where they're trying to find a trigger as to why your body is attacking those particular cells, but that's still in development. Scientists think that type 1 diabetes is caused by genes and environmental factors, but one thing we also discovered is that for every cause there's an effect. The fact of the matter is, just because they don't understand what causes something doesn't mean that there was something responsible for it. They think that for type 1 diabetes, that there's a certain protein, casein, and a certain presentation of casein in milk that somehow alerts the body and makes it more hypersensitive, where down the road, as you drinking milk as a baby, down the road, you may be susceptible to something like this. I drank a lot of milk as a child. I loved it. And my mother, she drank milk when she was pregnant. So I'm saying all these things are transferable. But they don't understand the specificity of all these things. So this is what's going on in type 1. Now, type 2 diabetes. Have you heard of type 2 diabetes? Now, what is that? It's the most common form of diabetes. It's caused by several factors. But the biggest issue with type 2 diabetes, a lot of people say, well, I ate too much sugar, so that made me susceptible to type 2 diabetes. Well, the fact of the matter is, type 2 diabetes is cellular, meaning that the cells that the insulin will attach to, so that think of insulin as like little keys, and then these cells are like doors. And so basically, the insulin opens up the door, so it allows the sugar to transfer into the cell, and then the body will utilize the cell. That's how it works. What happens with type 2 diabetes is somehow either the key gets jammed in the door, and it can't open it up again. You know how many times you broke your key off in the lock, and you had to get a locksmith? Well, that's what you got to do in your body. Or it's resistance. It's called insulin resistance, where your body has insulin, you have enough insulin, but for some reason, the insulin is not being responsive to your pancreas. And so it's a combination. So either your body's not producing enough insulin, or your body produces normal insulin, but the cells aren't absorbing it as properly. So it's a combination of things. It's not just one. Yes? Yeah, they've transitioned the names. They used to call the juvenile, juvenile and all. But right now, the bottom line, yes, you can have some insulin that is usually caused in childhood that is usually autoimmune. Whereas now, as we getting closer to the return of Christ, things are presenting themselves so differently. Now that you probably have heard of a type 3 diabetes, and then type 4. They go all the way, and all these are just manifestations of just the top two, either insulin dependent or non-insulin dependent. What they fail to understand is, for example, my brother is a type 1 diabetic, but he took a steroid when he was in the military. He was 27 years old. They gave him a steroid for a muscle injury. His body reacted to it and it knocked out his pancreas. Now he's type 1. So even though he wasn't born that way, and even though he wasn't eating that way, because of a drug reaction, he ended up being diabetic. So there's other types of diabetes. And then there's other people who are maybe in an accident and your pelvis and your pancreas is injured. And then you can sometimes have dysfunction and become a diabetic. So I'm saying there's multiple reasons for this. So what causes diabetes? And then we talked about overweight, obesity, physical activity. All this definitely contributes. And that's what I talk about, insulin resistance, extra weight. What people don't understand is that, and this is something that I got to work on some more, a belly is your enemy, because that is a sign of potential inflammation in your cells. Inflammation is one of the biggest, perpetrators of insulin resistance, because, again, it creates a mechanism where the cells that absorb insulin can become injured or destroyed in some respects. So that's some of the ways that people are transitioning. It usually begins with insulin resistance, a condition in which the muscle, liver, or fat cells do not use insulin well, and as a result, your body needs to produce insulin for these high sugar levels. And what happens a lot of times is that with this dysfunction that's going on, this mismatch, your body is trying so hard to compensate, eventually it gets tired, and that's where you start developing symptoms of type 2 diabetes. Because your pancreas gets tired, it gets kind of burned out from trying to overcompensate from dysfunction. So there's a lot of factors into all this. So it's no real direct. So a lot of times people, they say, well, what causes diabetes? A lot of things can cause diabetes, but there are definitely contributing factors that are more common than others. And this is just an example of some of the many causes that I'm not going to really go into. You have hormones and hormonal causes and damage, again, from removal of the pancreas. All these can cause, all these can cause issues with your pancreas. So these are other causes that aren't as common. For example, certain medications can cause, yes. Yeah, but it's not fully. But the thing about it, let me see where the hormone. Oh, yeah, it causes your body sometimes produce too many hormones, and insulin resistance can sometimes be an offshoot of that. They don't fully see. That's the thing about the body. When I say it's fearfully and wonderfully made, science, half of this stuff they don't fully understand. Now they try to make you think they understand it, but they don't. And so we don't know why certain people are more susceptible, because some people can have the same condition as others. They present this, and somebody doesn't present at all. Why is it that you are not, susceptible to this? They don't understand all that yet. So there's a lot of causes, and then there's medicine that causes. You have, various types of medication. You see here, niacin, too much vitamin B, which is a good thing, but I'm talking high doses can cause it over a long term. Certain diuretics and anti-seizure drugs and psychiatric drugs. All these can impact how your body absorbs. But here's the thing that I want to really bring to your mind, and this is what happened. This is my own personal testimony. The symptoms of diabetes include increased thirst, urination, increased hunger, fatigue, blurred vision, numbness or tingling of the hands or feet, sores that do not heal, thank goodness I don't have that problem, and unexplained weight loss. For me personally, I had just gotten married, and this was in 1999. No pun intended. But anyway, and I was basically, I left the hospital. I was noticing that I was losing weight. Now, I was very active at the time. I used to ride my bike. I was a big biker. And my clothes just started getting bigger. And I'm thinking, well, maybe I'm just having positive experience with my exercise. I'm doing something right. Then my appetite picked up. I was eating like a horse. Wasn't gaining the weight. And I'm thinking, it's not bad. I'm not getting fat. But it didn't stop. I kept losing weight. And so, and again, as I told you before, as I was putting together these protocols in the hospital for patients with diabetes, when something happens to you, all this other stuff goes out the window. I could be studying about diabetes all day long, but when it starts happening to me, I'm the last one to notice it. So I just blew it off. And I started noticing, I would have fatigue. But I do remember when he talked about blurred vision, I remember I came home from the hospital one day, and I was taking a nap. I was post-call. I was laying down on the couch. The phone rang. I jumped up to go answer the phone, and it's like an R. It's like somebody was shining a flashlight in my eyes. And I'm thinking, this is, that was a little weird. But again, little symptoms that popped up. But it wasn't until I was driving home from the hospital, I was going home, and I used the bathroom, and I'm like, I was halfway home and had to go to the bathroom again. I'm like, doggone it, what's going on I hadn't drinking anything, but my urination, it's just infrequent over a course of a couple of weeks. That is when it dawned on me, something is not right. I drove up to a Rite Aid at the time, and I bought one of those over-the-counter urinalysis tests, and actually that sucker came back positive. I was decimated. I was floored. I couldn't believe it. I'm like, are you kidding me? And now what you're hearing now, this was not part of this presentation, is my glucose monitor telling me that my sugar's dropping. Yeah, dropping. Don't worry, I got stuff over there. I'll be fine. But anyway, I got to turn this thing off. But the fact of the matter is that that's when I discovered that I was a diabetic. I went to the doctor. He confirmed it. He did all the blood work. I did all the testing, and he told me, and I was actually diagnosed as a type 2 diabetic initially. But I got on medication, and I tried various things, but of course, it just kept within a matter of months. I was very unique because I went from a type 2 diabetic to a type 1 diabetic in a matter of months. Why? I was already type 1. My body was already destroying and attacking my pancreas. And eventually, when I went back to my last lab test, he basically said, you have zero activity in your pancreas. Now I am fully insulin dependent. Now, just to let you know, that was very traumatic for me. And that is why I wrote that book. Because what people don't understand is that diabetes has a very potent traumatic component to this thing. Many of our mental health professionals, that's something that you could definitely touch on, is the mental component of diabetes. When you have a condition, and I'll talk a little bit more about that in a minute, where you have to be monitored 24 hours, 7 days a week, and you could be perfect for 6 days. You make one mistake, and it could be negative consequence, whether you can end up in a hospital or worse. So anyway, now let's talk a little bit about heart disease. Now I'll flip back around to diabetes in a minute. Now we know that this is just a list of all the different types of heart disease, and I'm just going to talk a little bit about this. But the main heart disease that we talk about that I want to focus on is coronary artery disease. We're all familiar with that, and then peripheral vascular disease. Now, what is the difference between an MI and a heart attack? Anybody know that? Take a wild guess. A myocardial infarction versus a heart attack. I'll tell you the difference. I'm not going to, make any drama out of this thing. The biggest difference is a myocardial infarction is when the vessels are narrowed because of blockages, whether it's atherosclerosis or whatever. Inflammation causes narrowing in the vessels. And so the blood, you just eventually get to a point where the blood is not getting enough oxygen, or I should say the heart's not getting enough oxygen, and that's when you start having symptoms like angina. Heart, you start getting pain and all these little things going on in your you have jaw pain, you can have pain in your arm. All that is because of a poor blood flow, and that would eventually lead to atherosclerosis or heart attack. We call it a myocardial infarction. Now, a heart attack is electrical. So your body, did you know your body's electrical? If you notice that when they hook you up to a monitor, you hear doot, 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 doot. That's the electrical component of your heart being measured. And what MI is when you start having what they call an arrhythmia, where the electrical component of the heart starts to be a little irregular. And then that could present with issues and symptoms. So usually, if you have an MI, you can get to the hospital, they can treat you, and you're better. Now, if you have a heart attack, if you don't have somebody around you or a or some sort of defibrillator, your outcome is much, much poorer. Because usually, if they don't begin immediate CPR, then by the time the paramedics get to you, there may have been too much damage to your brain for you to recover. So that's why if you see somebody, CPR is critically important. In fact, one of the things that I was talking to the conference about is I think it's really important for us churches to all be outfitted with an automatic defibrillator in the building. That's critically important because sometimes you don't have time for the paramedics to get there to administer. The sooner, the better. So we go, did I go in the right direction? Okay, yeah, I think this is right. So basically, we see heart disease. This is basically types of heart disease, and I'm not going to get into all this, but you have coronary heart disease or coronary artery disease, what we talked about. You have, also you have arteries you have arteries going up into the brain, carotid artery disease. There's peripheral vascular disease or peripheral artery disease, which basically vessels down below the waist. So as I said before, it's the same thing. A heart attack causes an issue, or MI causes a problem in the heart. A stroke is a heart attack in the brain because of reduced blood flow. Now, there's two causes of stroke. You could have reduced blood flow, which could cause a stroke, or you could have an aneurysm that burst. That could cause this problem. Those are really, really bad as well. So I'm just saying there's multiple causes of a lot of these general manifestations. Now, what's the precursor of coronary artery disease? We call it the pathology of an anthrometer. It's the accumulation of swelling of the arterial wall that's made up of cells or cellular debris, fat, lipids, and that sort of thing that causes issues in your vessels. So it's so important when people say, I need to watch what I eat and my diet. That will help reduce this impact of building up gunk in your vessels. Now, I just want to explain this because before I got into medicine, nobody explained to me what this stuff meant. Cholesterol. Okay, what is cholesterol? What does it mean, HDL, LDL? What does that mean? Well, high-density lipoprotein, or HDL test, when they say that they want to, this is basically cholesterol that acts as maintenance crew of the inner walls, of the vessels. So that's why you want that low. Now, LDL collects on the vessels and rise in your chances of heart problems. So when you talk about the flip-flop, you want one high, you want one low. So basically, the LDL, or low density lipoprotein, is what collects in the vessels of your body. Whereas high density lipoproteins acts as maintenance. It actually get rid of all of that. So you want one high, you want one low. Does that make sense? All right. And then you got triglycerides. And then these are just tests that they run. I just threw it on here because if you ever went to the doctor and they're saying, well, we're doing some lab work, some enzymes, CK, CKMB, myoglobin, or troponin, all they're doing is trying to see if you had the effects of a heart attack or if your heart is functioning properly. And then these are just common cardiac tests that they're going to give you, cardiac catheterizations. They'll hook you up. They may want to, if you've never been to the hospital and they put pads on your chest, they just want to see what your heart function looks like. So they just want to see what the electrical activity. That way they could determine whether your heart is being stressed by poor circulation. They can determine all this stuff. And I'm not going to get into all this. But these are just tests in the back of your mind to be aware of, because if you go to the hospital and they're running these tests, this is what they're looking for. Just kind of being aware. Now, it's kind of interesting, a stress test. I find it interesting because I was telling a friend that, calls me and said, Mark, I just did a stress test. And they say my stress test, I passed it, but barely. See, a stress test will tell you if you're in shape or not. They'll put you on a treadmill, and they can tell whether if that's your first time moving all day. But anyway, so we see various treatments. So we see that the first thing they'll give you is medicine. They'll give you blood thinners or statins or beta blockers or nitrates, and all these are basically ways to help your body to help determine whether the controlling pressure in your system. Now, I'm not going to get into all the specifics of all this stuff, but I find it interesting that statins, for example, the first thing they put you on, if you go to the hospital and they think that your blood pressure is a little elevated, or you have diabetes or have anything, they want to put you on a statin. You ever heard of statin? Lipitor and all that class of drugs? Well, the problem with statins, and I'm not going to discourage anybody from taking a statin, because if you need it, you need it. But they have a lot of side effects. And a lot of side effects they don't tell you about. I was on a statin for, because I'm a diabetic, they say, well, we want to get your levels to this level. And I have to admit, I cheated a little bit, and I wasn't the best as far as what I was eating. And so my levels were a little bit elevated. But they put me on this one statin that my body reacted to very negatively. It made me really loopy, made me, kind of woozy. In fact, I even one time passed out. So they took me and they ran all these tests, nothing was wrong, and found out it was the medication, which can happen a lot. So if you're not feeling well, the name of the game is just get it checked out. Make sure that you get it checked out. And another thing I encourage you is you don't let them tell you what's wrong with you. You know what I'm talking about? Basically, advocate for yourself. If you're not feeling well, and they can't figure out what's wrong with you, just because they can't figure out it doesn't mean there's nothing wrong with you. It means that they can't figure it out. Get a second opinion. Anyway, that's another. All right. So, interventional procedures. So let me go back here. So, if you go to the hospital, and they're checking you, your blood work comes back negative. Now they take you to what they call a cath lab. People understand what a cath lab is? They go in there, and they basically will line you up to see what's going on in your heart. So they can take pictures. They can see what the blood flow is going on. They can see if there's any blockages. This is how they diagnose if you're having any heart issues. Or they can even look at your legs and see if there's poor circulation in your legs. Or even up into your brain, they can see what's going on. And this gives them a better idea of what's going on. And then there's interventional procedures. You have angioplasty, have endovascular procedures that they can do. There's ways that they can go up and open up blockages in your head, as well as down your lower limbs. But a lot of people have never really heard about interventions down your lower limbs. And that's the challenge, and that's why I'm here, because so many amputations could have been prevented had they at least checked. And if they know that you're having poor blood flow in your legs, then outsource them to a cardiologist that has the ability to open up those vessels in your legs. You don't always have to cut. That's your very last resort. So that's my take-home message. Now, this is a guy that was supposed to be working. I don't know how he had time for a photo op. And that was me. I was basically, it was on Sabbath afternoon, and my page, actually I was at church. And it never happens, it always happens when you're at the most inopportune time. I came up front for prayer. In the middle of prayer, my beeper goes off. And I'm like, what was that? But anyway, and so after prayer, I go out in the hallway and figure out what's going on. They tell me that we have a patient, that the surgeon said that he wants to have the team come in. We have a patient they have 3-vessel disease, and he has what he had was what they call a left main stem. Anybody know what a left main? That's the big vessel in the heart. So it was 99% blocked, and he was having chest pain. So they're like, we're not going to be able to sit on this guy over the weekend. We're going to have to operate on this guy now. And that's what ended up happening. He had 3 vessels. He ended up having 3-vessel bypass. They corrected they bypassed the left main. And so he started having blood flow restored back into his heart. And he did fine. Now, what I tell people all the time is, you see, they put you on television as some savior. But really, heart intervention is just nothing more than plumbing. Something's getting clogged up, they got to unclog it. And that's all they do. It's just nothing. If you don't change your outcome, you're going to go right back into the hospital having the same issues. You have to change your diet. You have to improve your exercise. And I'll talk about that in a minute. Now, when we talk about diabetes testing, you have the main thing that they do for you if they suspect that your sugars are out, and I heard that they're going to do some blood testing here, which is good. They can check your sugar, is what they call hemoglobin A1C. And basically, well, I'm not going to get into all that, what that is, but it's a 3-month test where they can maintain, and they can tell whether your blood pressure's been high, whether your blood sugar has been high, moderate, high, and that's how and then these are levels, these are numbers that they look at to determine if you're at risk of diabetes. And so if your A1C is below 5.7, you're normal. If it's 5.7 or 6.4, you have what they call prediabetes. And if it's 6.5 or higher, you're full-fledged diabetic. And that's just basically saying that your blood sugars if your body wasn't able to bring it down to a certain level, there's something else going on. And that's really how they're able to determine this. I'm happy to tell you that as a 25-year type 1 diabetic, my A1C came back at 5.8. So I'm happy, because I was able to maintain, with a defective or dysfunctional or non-existent pancreas, even with being on therapies of insulin, I'm able to maintain an almost normal level. So my body thinks that I'm almost normal. And that's a good thing, because if I can do that, hopefully that'll push off all the bad stuff down the road from happening to me. Now, this is various treatment. Diet exercise is their first one. And if that's not working, then they'll give you oral medications, and there's a whole ton of those that I will comment on. Now, as far as oral medications, these are all the chemical names of some of this stuff, and there's brand names. For example, have anybody heard of a GLP-1 agonist? You've heard of that? Okay, we have nurses in here, so if you have any nurse in here, don't answer the question. But the fact of the matter is, have you heard of Ozempic? It's in this class. It's actually a diabetic drug. And the reason why it helps people lose weight is because, even for diabetes, is because it helps suppress your appetite, among other things. And it also helps reduce the absorption of glucose and all this kind of stuff. So that's why people with diabetes are prescribed that. Now, a lot of people have lost a lot of weight on Ozempic. They had wonderful stories of success. But they're not telling you, and what you don't hear as much about, is that Ozempic has a dark side. Have you heard about that? There's one of the side effects of Ozempic is that it stuns the cilia that lines up your intestines. See, when you eat, there's little hairs that help push the stuff down. And what Ozempic can do is stun those stairs, where people have issues now with digestion because their food is not being completely pushed down where it needs to be. They don't tell you that. But anyway, But the fact of the matter is there have been a lot of success stories. And this is, of course, you know insulin. There's various types of insulin that people take. And then this is all kind of an overview of everything. Now, there's various types of insulin that people could take. You could take fast-acting. There's super fast-acting. There's longer-acting. For me, I take two kinds of insulin. I take short-acting when I immediately after I ate a meal to break it down. And then I have long-acting overnight because even as you go throughout your day, depending on the types of foods you eat, your body will still have a gradual increase of sugar over the night while you're sleeping. And even your liver sometimes leaches out sugar from your daily activity. And then that's why they tell you to be careful of the types of food you eat. Now, if you go to bed and you eat pizza, which is a complex carbohydrate, which is going to it's going to continue to leach your sugar. So you wake up, your sugar might be 300. Well, it's if you're diabetic. So there's certain foods, and I'm not a dietitian, so I'm not going to get into all the specifics of that. But so in summary, lifestyle changes can help lower your risk of heart disease and keep you from getting worse, as well as help you manage diabetes and aim for healthy weight, be active, and manage, we call it the ABCs, which is A1C, blood pressure, and cholesterol. Those are checked, and those are in good order, then you should be good. Now, I'm going to talk a little bit about ways to help minimize all this stuff so you don't have to go to, the biggest challenge, and when I used to talk to people about heart disease, I tell them what heart disease entails. My niece had an infection when she was a child, a infection in her tooth, and she didn't get that checked out. And they suspect that infection in her tooth affected her in adulthood because now she had what they call mitral valve regurg. That means that the valve is not completely closing, and there's a little bit of blowback of blood every time the valve closes. So that's what they call it regurg. And they hear what they call a murmur when they oscillate her. We're hearing a slushing sound. There's something going on with that valve. They checked her out, found out that she needed heart surgery. We needed to have that valve repaired or replaced. So she did that. Now, what's interesting about all this, again, is that we have to understand that there's a lot of cause and effect. Even for infections where you can have strep throat, you can have rheumatic fever, a lot of these infections can have long-term effects on your heart. So be careful and make sure that you don't sit on things. If you think you got an infection, go get antibiotic, get it checked out. Don't let a lot of these infections stay in your system as long as longer than normal, because that can have lasting effects in other parts of your body. Now, I call this, food is medicine. We all know about this. We're finally getting to a point where people recognize that there's more to food than just nutrition, right? So, and the Bible says in 1 Corinthians 10:31, so whether you eat or drink or whatever you do all for the glory of God. But modern science is discovering that what gives foods their color, we call it now phytochemicals. They're naturally occurring compounds found in plants that aren't essential nutrients like vitamins or minerals, but they have been shown to provide health benefits. Essentially, they're the bioactive chemicals in fruits, vegetables, grains, legumes, and other plant-based foods that help protect the plant. And in essence, it protects us. And this is why vegetation was allowed into our diets. Now, I find this interesting as well. Now, I'll just share this. Doesn't really make a big difference, but I'm going to share it anyway. When they discovered nicotine, not nicotine, but when they discovered other plant components, many people tell you, well, I don't drink coffee because of caffeine, blah, 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 blah. What they found that caffeine, now I have training in toxicology, so that's why I know this stuff. Caffeine, for example, was when a bug, a pest, eats a plant that has a large amount of caffeine in it. The caffeine in the plant it short circuits the bug's neurological system and kills it. But yet we drink it, say, well, it's good for you. But they don't understand the relationship that exists. If it kills a bug, what's it going to do to us long term? Anyway, that's just another conversation. All right, so when we break down our foods, we have the various categories. I call it the blues and the purples. And give me an example of a purple or blue food. Eggplant. What else? Blueberries. Well, that's the lighter color. Blue. Red, that's another color. All right, it's the blues or purples. And I'll give you figs, purple grapes, plums, prunes, elderberries, black currants, blueberries, blackberries. All these are, and basically they have phytochemicals called anthocyanins or phenolics. And basically they're good for inflammation, collagen, eyesight, diabetes, large blood vessels, small blood vessels. A lot of vascular issues are augmented by eating foods in this category. Blues and purples have certain types of phytochemicals in them. Now we're talking greens, fruits, and vegetables. And we see that, again, all the different types of green vegetables, all the different types of green fruits, even green apples. Where red apples have certain phytochemicals that are different than are found in green apples. Same thing, you have the greens. And this, I think, not only are the purples critical for women, but greens are very critical for women. Many women suffer from osteoporosis, which we all know what causes those issues that they have. But greens also have high sources of iron and calcium, so that's why spinach, especially the dark greens. But anyway, phytochemicals are found called lutins and indoles, and basically it helps build strong bones, makes proteins, release energy stored in muscles, and regulate body temperature. So all of these, so that's why they tell you to try to touch on every color in the rainbow when we eat. Now we talk about whites. Now we're talking potatoes. Quercetin, allicin, glucosinolates, flavonoids, saponins. All these are found in the white and the lighter color foods and vegetables. So, white vegetables also are rich in potassium and magnesium, potassium is good for heart health and cellular function. Same thing with magnesium. All these are critical for how your body functions. Cardiovascular health, high cholesterol, antibacterial, antioxidant. In fact, they found something interesting about allicin, which is found in garlic and in those particular foods. Do you know that they've done studies, and they found that allicin is the only agent that bacteria can't mutate against? You heard of superbugs? Have you heard outside how they tell you that if you take bacteria for certain long, they have to kind of switch it out because your body becomes resistant? Bacteria cannot develop a resistance to allicin, and they don't understand why. God has an intelligence that is far beyond the ones that he created. So blood clots, all this stuff will help. So to make a long story short, allicin is a natural antibiotic. Garlic. In fact, yes. In fact, it's the most potent when you first crush the garlic. It's extreme. But even in capsules, allicin has efficacy or has the ability to help you health-wise. So when we, as Adventists, we know about nutrition and the New Start. We've heard that acronym. Nutrition is critical. Any dietitians in here? Exercise is critical. I know my man here, Eric, is premium when it comes to exercise. But also, water. Water is critical. Do you realize that chronic dehydration is one of the biggest precursors to arthritis? Because all of the body is, we're first of all 70% what? So it makes sense to us, it's kind of counterintuitive that we need to drink a lot of water. But when we don't drink water, now we're starting long-term damage because of the various vessels around and the various, the mechanism that are around the ligaments and in joints and they're filled with fluids. If they atrophy, now you have a higher damage level. And so just the everyday going about can cause problems. So again, water is necessary for hydration. Sunshine, what's sunshine good for? Vitamin D. What else? Do you realize that sunshine is also a very potent antibiotic? When you're recovering from a sickness, it's interesting how Sister White has told us, in the sanitariums, that they always had the windows open. They wanted light coming into the hospital rooms. But for us, They don't have a lot of light coming in their hospital beds. But it was that light had elements in there that was critically important for us. And so we see that sunshine is necessary. Temperature, moderation. In fact, what I recommend is that you open your blinds and let the sun come in, because it really kills a lot of germs in your bedroom and in your house in general. Sunshine, temperance or moderation. We all know that makes sense. Too much of anything is bad for you. Too much good stuff is bad for you. Moderation. You could cheat from time to time. I'm a diabetic, and yes, I've eaten a donut. But I don't sit there and eat donuts all day. Fresh air. Rest. Now, rest is probably I think that's the most underestimated component of health. People say, why? Because rest is where your body repairs itself. During a rest is where majority of restoration from your daily exposures occurs. So the less rest you get, the less your body restores itself, which causes problems down the road. Everything is synergistic. It's amazing how if one thing's out of whack, it'll impact something over here that you don't even pay attention to. So people that say, well, I only get 3 hours of sleep, you keep that up, your body is going to push back on that, and within years, you're going to start having issues on this side, and then it's going to be attributed all because you didn't get enough sleep. And then, of course, trust in God. God is the one that heals us. God puts us in a position where we can recover. Now, it's interesting, a personal testimony, my wife, when was that? It was early part of January, slipped on some ice, fell back, and suffered a severe TBI. She's still recovering from it. She was on disability for a little bit, but let me tell you what really helped her recovery of all this. One of her physical therapists recommended her just go on walks. When she started walking, her brain function almost exponentially started to improve, almost like overnight. And to this day, she still walks. And she had one setback, but now, as we go into basically September, she is now fully starting to recover from this head injury. And a lot of that had to do with just walking. Walking is one of the most comprehensive exercises that you can ever do, because it exercises every element of your body. You walk and breathe in deep. Just walking. A lot of people, when they think of exercise, they think of being Eric. Working out. I'm like, I don't want to do. Just go for a walk every day. And the benefits you get from just walking is exponentially unquantifiable. People, they don't even understand the full benefits of a brisk walk. And you just breathe fresh air, you have oxygen consumption, all your muscles, every muscle in your body is impacted by just a walk. In fact, Sister White says that's the most complete exercise the human body can ever endure. So this was my book, my testimony. I encourage you, if you have time, that you can scan that. That'll take you directly to Amazon. I said that because it's the Sabbath, I'm not going to have a book sale, so I just talk about it. But I encourage you that it's something that's really important in African American in dogma, from the standpoint of we don't really talk about the emotional impact of diabetes. We've talked about, and then the reason why I wrote this book was because when I looked at all of the different diabetic books that are out there, all they talk about is the pathophysiology of diabetes. All they talk about is I know that diabetes is insulin. I know that diabetes is I get all that. But the impact is what's amazing to me. The impact of I was an angry black man for years after I became a diabetic. I was mad at God, and I was mad at life. I was upset because as a person in health, I was like, Lord, why did you do this to me? This is the most, and Well, I won't even go there. But the bottom line is that the Lord used that as an antagonist for me to say, you know what? Because I wanted you to be, if I give you a little spur, enough of, just like with Paul, I'll give you, slighten you with an infliction. Now I know that you're going to be about telling others about this health message. And this is how I present it today. And that's why I'm here talking to you about it today. Diabetes is a miserable condition if you allow it to be. But I love it. But I'm glad that I'm able to overcome it. Yes, I see. I'm glad I'm able to overcome it. And as a result of that, I tell others that don't let diabetes is not a death sentence. It's just a condition that can be controlled. And if you control it, you can live wonderful, long, healthy lives. But let me tell you something. If you don't control it, that thing can control you, and you don't want that. Yes? Lack of magnesium? There is deficiencies, yes. And you can offset that by taking magnesium supplements. Mm-hmm. That's it, and a lot of that has to do with nerve function. See, one of the challenges, one of the disabilities, or I should say, one of the challenges of diabetes is, again, the circulation. By taking magnesium, that helps within the circulation system sometimes. And you also nerves. Nerve function is critically impacted by magnesium. So if you have low magnesium, it can affect your nerve function. By replacing that, now your nerve function have improved. Main thing is making sure that your circulation is improved as well. Yep, B complex is all very, very good for all of that. Absolutely. Mm-hmm. Now, are you a vegetarian or do you eat meat? Okay. 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 Yeah. Right. Do you walk? Excellent. Excellent. That's. I'm telling you, walking really helps. Okay. Amen. Well, that's good to hear. That's good to hear. It's such a delicate balance when you think about all of these different elements. But yes, I'm gonna give you a little. I'm gonna give you some little tips that if you know anybody that has diabetes and they complained about, one of the most serious side effects of diabetes, obviously, is kidney disease, having acute renal injury, and also poor circulation in your legs. If people complain about sores that don't heal on their legs or on their feet, make sure they go to their doctors and have them check for their vascular status of their lower limbs. Here's a little telltale sign. If you don't have hair on your toes, go to the doctor. That's right. Because that's a sign of poor circulation. Now, that's not a telltale sign, but that's a, so I'm saying, don't say, oh, Lord, I'm about to die. No, it's not like that. But, yes. Yeah, that's right. But the toes are the most distal to your heart. So you want to make sure that if you have at least a little bit of presentation of something down there. But if you're bald down there, just get it checked out. No, you go to a podiatrist. You go to a foot doctor. But I'm just saying, these are little things that they don't tell you. Just to be pay attention to. Hey, my thing is, I want to know as much as I can know. And then a lot, like I said, a lot of people, they love to shave off. But I'm just saying, hair growth is a sign of adequate circulation and adequate nutrition in your limbs. And when those things are not there, they just kind of put your spidey senses like, is there something wrong with this? Now, it could be nothing wrong. Genetically, you could just have bald toes. But it's still something you still rule out. Look, I'm the kind of person, because I used to be in the hospital all the time, and the way we used to manage our patients, I like to check boxes. Check, 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 check. Okay, I'm good. Because there's a lot of people that present to the hospital thinking they have a heart attack, and they find out you just have gas. Because there is what they call there's a syndrome, angina syndrome, where there's people that can get certain pockets of gas because they were, where it could get in behind there, and you could think you having a heart attack. But you get there, and they find out you belch or you pass gas, and you feel so much better. You're like, Lord have mercy, I thought I was dying. So there's no telltale sign, but I'm just saying little things that you want to pay attention. If you have sores on your legs or limbs that take a long time to heal, get that checked out. And because the problem is that peripheral vascular disease is the most, when you talk about many of the circulations and circulatory induced complications, usually that's the last one that people really pay attention to. And the sooner you know something's going on, the better you can preserve your limbs. Because I'm part of organizations and advocacy groups that we do what they call limb preservation. And because African Americans have the highest incidence of amputation of any demographic, it seems like we just lead everything. But we don't have to be like that. If we change our diets, if we stay on top of it, and a lot of that has to do with poor access to health care. When I'm meaning that some people, the urgent care or the ERs, they're only doctors that they see for years. Don't wait until something's bad before you show up to get checked out. So I encourage you, even if you want to go to a community health event, or even if you don't have a doctor, just get tests, get screened for certain things. Just they rule certain things out. Don't blow stuff off. And I tell people all the time, and the reason when I made the statement earlier that you better than anybody. So many times I've had, I could give you example upon example upon example where doctors were wrong, and if you didn't advocate for yourself, you can suffer negative consequences as a result of that. And that happened with my child. My daughter was an asthmatic when she was young, and they changed her medication. It was inhaled. They changed her preventative. She got on it. Within 2 weeks, everything that she was allergic to amplified, and it will send her to anaphylaxis reaction. We have to give her EpiPen and take her to the hospital. That happened 3 times while she was on this medication. The last time I'm like, what's going on? Something's not right. Well, I don't know. What did you do differently? The only thing we did differently was put her on this medication. Well, it couldn't be the medication. Why couldn't it be? Well, they couldn't answer that question. So I said, I'll tell you what, hold your thought. I went into the hallway, I picked up my phone, and I called the company's medical affairs department. And I said, tell me everything you can tell me about this medication. My daughter's having this problem. So she said, well, I'm looking. She was a pharmacist, by the way, and she was looking. She said, well, at the very end of the document, it said hypersensitivity, 3%. Well, and that's something. I took it back to the doctor. Look at this, hypersensitivity. She's one of the 3%. So don't tell me it's not possible. So that's why you always advocate for yourself. And they got off the medication within a week or so. Everything resolved. She was no longer super sensitive to everything. I mean, my daughter opened up a Kit Kat. She started developing anaphylaxis, and we had to give her EpiPen and drive her to the ER. That's how sensitive she was to it. But before, that wasn't a problem. So I'm just saying, when you see stuff, you know you better. You know your child better. If something's not right, don't let them just tell you, there's nothing wrong with them. Hypochondriac. No, it could be something wrong. So, yes. Mm-hmm. Inflammation is a big proponent of a lot of the problems that we're having. Inflammation's a lot of the cancers, a lot of the other chronic conditions that we get, particularly cardiovascular disease or whatever. Yes, inflammation is a big proponent of that. One of the most effective ways of combating inflammation outside of eating foods that don't produce a lot of inflammation, which is usually processed foods and foods that are high in fats and that sort of thing. There's an herb that you could take. Well, thyme, but also, what was that herb? Turmeric. is one of the most effective anti-inflammatory herbs that you could take. So even eating foods that are sprinkled with turmeric. Now, yeah, even certain peppers, absolutely. Like I said, food is medicine. So we can reverse a lot of our conditions by the types of foods and the diets that we have. Yes. Anybody have any questions about anything? Diabetes, heart disease? Yes. Mm-hmm. Partially. See, it depends on the type of diabetes you're talking about. Type 2 diabetes is the pancreas you have some function in the pancreas. But then it's a matter of, is it that your pancreas is not, if you're not absorbing the sugar, or if you're not producing enough insulin to break down the sugar? Because really all high sugar is basically the insulin, and you're not producing enough insulin to drive the sugar into the cells. Because that's why you have frequent urination, is because your body is not metabolizing the sugar. You're not putting it in your cells, so it's just floating around in your system. So your body is like, I need to get rid of this. So where's it going to get rid of it? Through the kidneys. And that's why people increase their urination. Your body's trying to get rid of all this excess. And then they run tests to make sure, to see if your body's been trying to offload all this extra sugar. So then there's certain tests that they check to make sure your kidneys and all that is functioning properly, or is it elevated because your body's been trying to get rid of all this extra sugar. And that's why they're always testing your your albumin, they call it, and all these side effects of them trying to get rid of your body, trying to get rid of all this excess sugar. Any other questions? Yes. Oh. It's so funny because I get annual foot exams as a diabetic, and my podiatrist said that that's the telltale sign of good vascular health, is making sure that you have. So, and that's something I never thought about. I'm like, but it's something to consider. And also, as far as even with heart disease, a lot of times heart disease doesn't present itself as the classic symptoms where you have pain in your arm or shortness of breath. Those are the classic symptoms. But sometimes people could feel like they're having an indigestion, where you just start having heartburn. You can have, pain radiates. And this is why I encourage us as Adventists, as I say, food is medicine. One of the biggest challenges I have talking to Adventists about health is that we try to self-medicate ourselves, and we treat ourselves. Just because you have a backache doesn't mean that the pain is originating there. Or you're having a headache. You could have chest pain. You could have mid chest pain. I don't want to get on technical terms, but you can have pain in your back, substernal or pain, or even pain in your back. Some people. I had a person telling me that. Well, my back was hurting. I said, how long was the back hurting? I don't know. It just kept getting worse. Did you go to the doctor? No, I just took some painkillers. I said, dude, you could be having an abdominal aneurysm, for crying out loud. Go to the hospital. They went to the hospital, and for them, it wasn't even just back pain. They found out that they were having, it was actually, their colon was actually extended that was causing pain, and so they ended up having, yeah. So I'm just saying, treat yourself naturally when you know what you're treating. Don't start there, end there, if you want to end there. But even with that, moderate, eradicate, and then you can maintain. But so many people wait to the last minute. I'm on my deathbed, and I have a sad story in that regards, because there was a young lady that attended our church. She was 28 years old, and she was sick quite a bit, but she never went to the doctor. I didn't know. We would talk to her. Come to find out, a week ago, I was unfortunately called to the hospital. She passed from a ruptured aortic aneurysm. aortic. She had symptoms, but again, sat on it. And when you get to a point where it ruptures, I promise you that you had symptoms before, but you just blew it off as something else. So I guess the name of the game, and I'm done now, is that if it doesn't feel right, get it checked out. Don't sit on symptoms, because you know when something's not right. And I know men many times many times wives are telling you, go to the doctor. I don't need to go to the doctor. No, you need to go to the doctor if you want to keep living, because there's things that can happen that you can prevent by just early diagnoses. I'd rather go to the hospital and they tell me there's nothing wrong with me than for me to go to the hospital and they said, if we had known this before, we would be able to do more for you. So that's kind of where I am. So thank you so much for your time and attention. If you have any questions, I'm happy to talk to you afterwards as well. Thank you so much. So back here.
Always a joy. I could listen to you like for hours, man. Just the wealth of knowledge and the simplicity of how he presents it is just awesome. So what I have here is his book, and there are 4 lucky winners today. And I guess my first prize winner would be, is there anyone in here who has type 1 or type 2 diabetes? Type 1 or type 2? You have 2 over here? Mom has it?
If they're borderline, they're most likely.
If you're
You're
borderline? Okay.
So if you're borderline, you're mostly likely type borderline type 2.
Make sure you read the book. Read the book. Like I said, the psychological component is huge with something like this. So once you understand and how you
No, when you talk about the psychological component, it's not just relative to the patient, but also to the caregivers. My wife didn't really appreciate what I was dealing with. And now it's almost they overcompensate, because if I exhibit any symptom, Mark, you okay? Did you check your blood? I'm fine. But it's good for them to know, because they can act. Because diabetes, you can progress. What I didn't share was during my presentation was that I almost died of March of last year because of diabetes. I had been sick. I was dealing with a viral infection, and I was just sick, and I was tired. I didn't sleep that well, so I was home alone. My daughter was at work. My wife went to work, and I just got, my sugar was dropping, wasn't paying attention. I got sleepy. Just went to sleep. Next thing I know, now it was just me and my dog. I was watching TV. Next thing I know, he's coming to. I'm looking around. I'm seeing my brother and 2 paramedics in my bedroom. And so I'm like, first of all, as I'm coming to, I'm thinking, wait a minute. I went to bed. It was just me and my dog. How y'all get in here? And then I'm thinking, where's my dog? Because my dog's not exactly going to just let him in. And so come to find out that my brother, it was a long story to that, and I don't want to bore you with all that story, but basically, my wife, my daughter, I was supposed to pick my daughter up. She called my wife. My wife was like, he normally responds. Why is he not respond? She called my next door neighbor, who sent her son over, and my dog was barking at him like crazy. She said, if he's here, he would definitely know. So then she called my brother, who doesn't live that far from me. He came in. She let him in the house, and come to find out, I was unresponsive, laying in the bed. And the paramedics were able to come and resuscitate me. It said it took them about 20 minutes. They were about to put me on IV, but they I came to, and once I came out of it, boom, I just came right back. Didn't even go to the hospital. But my point is that this is how this condition is. You could be fine 1 minute and life-threatening in the other. So it was 38, 40, something in that range. It was really low, low, low. I could have easily slipped into a coma. If they didn't come, but see, this is where the spiritual component comes in. See, God basically said, because the way things work, my wife, when she's at work, she wouldn't have just jumped on it like that quickly. But the Holy Spirit prompted her, you need to take care of this. And that's where God comes in. That's why we pray every day, because God says, your time is not yet. Thank you, Jesus.
Amen, amen. Okay, so I got 2 more left. Should I do a pop quiz? Okay, he's giving you a meatball. There are 2 types of diabetes. What are they? Type 1, type 2. Well, yeah. What was that? What is it?
She's a nurse, it shouldn't count.
Gestational.
I would just say what Sister Cora said. She said when you're pregnant. She said that.
Okay. Yeah? Okay. Sister Pam? There you go. Okay. No, don't read. Don't be sharing books. Buy the book. Okay. Here's the last one. Here's the last one. This is for those who are on time. How many years ago did Mark discover that he had diabetes? 30. Who said 30? 31. 31. I heard a voice. Who said it? Sister Yancy? That's a long time ago. Huh? So does anyone have any extra questions concerning diabetes or heart? Your heart? This guy, he has a wealth of information for you. So I do have a question. Huh? Metformin? I guess, yeah, being a holistic person as well as a medical professional, he knows. But you have a question, Michelle?
Okay, for pre-adolescents who is diagnosed as being pre-diabetic, how can you instill in them the need to, take care of themselves? Like as an 11-year-old, how do you tell an 11-year-old, you can't eat that, you can't eat this?
Get them to exercise, right? Are they moving?
The reality is that they're never going to understand at that age. They just won't appreciate it. But only way that you can help them to appreciate it is to point them to others that are dealing with the issue. It's more of giving them an example. Uncle so-and-so, or I'm sure, I don't know if you have anybody in your family that has diabetes. Do you have anybody, or do you have any friends that have diabetes? Oh, okay. You just say your child. Well, they have such, they have, there's ways that there's books that they have now, periodicals that they talk about childhood diabetes and some of the things that they should be careful for. If they're borderline, the best way, again, is for them to understand that if you don't change your behavior now, right now you can't relate to it. You're going to be dealing with this thing later in life. And there are books that sometimes actually highlights and on their level what that transition will look like. But as far as trying to, I can't tell someone, because even my kids, they couldn't really appreciate what I was dealing with until they actually saw me dealing with some of the things I was dealing with. And that gave them a different perspective. But, at that age, you're invincible. Nothing bothers you. I'm just, I don't, sickness, okay, I may get chicken pox or, but as far as anything bad, I bounce back and, that's just not our mindset. But you just have to kind of give them examples as they kind of get older, then they begin, to make the to put two and two together. But when they're really young, it's really difficult working with young adolescents. And I find it sad when I look at some children and peds that are suffering from some of these conditions because they can't really quantify it, unfortunately. Yes. Well, everything is so different now. Even professional athletes. In fact, one of the biggest syndromes that many professional athletes are dealing with is they're so conditioned that they're stressing their skeletal systems, which is causing a lot of other. If you notice, you've heard of a lot of athletes that are dropping dead or having heart issues. Even Barry Sanders was diagnosed with heart disease recently, because they see. When we talk about the eight laws of health, one is moderation. They're so overly conditioned that their body is in a constant state of, they call it stress, because it's like they're at the edge. Even when they're at rest, the body is almost like at edge, and their skeletal system, their muscles are so tight that it stresses their skeletal system, and their brain is trying to augment all that, which causes problems down the road. And that's something that's been relatively new within the last 20 years, 30 years, and that a lot of the sports medicine doctors are trying to evaluate now because they don't fully understand it, because in their mind, it's always been the more conditioned you are, the better health you have. But now they're pushed past the point of critical mass, and a lot of this was perpetuated with utilization of steroids. But a lot of times now that they've cut steroids back, even though they work hard, they're not as, well, I'll take that back. It's still pretty, their system is super stressed, and they're just on a hyper end of normal, which is kind of weird.
I have a question. This is, I don't know if it's relevant or not. Maybe concerning type 2 diabetes, where you're insulin resistance. Is there a correlation with muscle building and muscle mass that may help maybe alleviate that condition with A1? A2, I'm sorry, with A2. Type 2, I should say. Like if I'm, like say, I could be
like being a bodybuilder or doing bodybuilding type of exercises.
Yeah, building muscle, doing your curls, your push-ups. Because I guess I guess relearning how muscles work and how to pull glucose
Yeah.
out of the system, everything.
I will say this: everything has a relationship. It's all synergistic. The biggest thing with type 2 diabetes is, again, it's a cellular thing, and trying to augment and prevent the fuel that makes the disease more complex or progress. One of the advantages of the 8 laws of health is that the body has the capability. God has created us with the ability to heal ourselves. So we have to find the blend. We can't overcompensate one area involving healing. You still have to get your rest. You still have to watch what you eat. The exercise is important, but you still need fresh air. You still need sunshine. You still need all these other elements to maintain that they call it homeostasis. And so I would say that it may have some impact, but the major impact is more of a holistic approach.
You good? Okay.
Type 2 is reversible. It's reversible? Yes. Type 1 is not reversible because your body has. Type 2 is reversible because it's, again, you're basically training yourself to overcompensate for wherever your body's dysfunction is. It's insulin resistant. So if you eat certain foods, you have a lifestyle where you reduce the load, where your body has to produce extra insulin to keep your sugar levels down. And that's what it's all about. That's why they say it's reversible. A plant-based diet has shown the ability to be able to reverse type 2 diabetes. There are certain types of foods that you eat on a regular basis, prevent your blood sugar from spiking. Type 2 diabetes, again, a lot of times it's your body's, the pancreas is tired of overcompensating because of people's lifestyles. And so if you align all that, you can reverse it. Type 1 is not reversible because it's an autoimmune reaction. Yes, but that's not that will be considered a syndrome of type 2. You have, yes, there are certain medications that you could take for something else that could be very, what they call it, have toxicity where it affects your pancreas. That's where we talked about certain hormones, certain diuretics. There's certain drugs that can cause that. But, is it reversible? It depends on the type of damage. It may be reversible in some cases, but it's hard to really tell. But type 1 is your body's own immune system targeting your pancreas as bad, and it destroys itself with like any other autoimmune condition, like lupus and all the other autoimmune conditions, which they don't fully understand, even though there's triggers.
Right.
Yes, most cases, if you're borderline diabetes, it's only because they've noticed that your pancreas isn't operating as efficiently as it should, and you can correct that. The only way that you jump to type 1 is if your body is attacking the pancreas and thinking that it's an enemy, and it's saying you don't belong here, and it's just attacking it, destroying it, and then you have no function as a result of immune onslaught.
Wow. These questions keep popping up, and I keep getting the sign. but it was great getting the knowledge that we need to know. And I have one more question. So this is, and I've heard this said to me before too as well. Talked about sugar. I heard someone say to me like, "Oh, fruit. You shouldn't eat as much fruit because fruit has sugar in it." You shouldn't eat it. You shouldn't eat as much fruit because fruit has sugar in it too.
I'll just give an example. When you think of drugs and drug therapy, there's the reason why, and for the nurses in here, you know about a PDR. And the reason why the PDR is so fat is because pharmaceutical drugs aren't completely metabolized, causing the side effects. Whereas, there's a difference between an apple and apple pie. The fact of the matter is that an apple has cofactors in it that minimizes the impacts of a lot of these side effects. So that's why you eat an apple, unless you have an allergy, you're not gonna have any side effects. Whereas a pharmaceutical drug is man's attempt to replicate what he saw in that apple and try to reproduce it, but he's not smart enough to be able to reproduce it completely. And the side effects, or the incomplete metabolism is what causes all the side effects. I discovered this when I was doing my toxicology internship. We found out that there were scientists that are out there in Indonesia and in Amazon and all these places around the world, while they were telling us that that stuff was hogwash, they were going to the medicine men and asking them, what do you have for this, and that? They would have their little portable mass spectrometers and kits out there. They're trying to find an active ingredient. They found that it was a 7 or 8, 9-step mechanism of breaking it down, a metabolism, but they were only able to reproduce 3 steps. Hence, side effects from all the rest, because they did not have the ability to identify the biomarkers and the cofactors to minimize the total effect. And then lastly, an apple itself, if you look from a scientific perspective, an apple will be unhealthy for you because it's very high in nitric acid. But the fact of the matter is there's other cofactors that completely mitigate the nitric acid, and you still have benefit. So that's my point. We're not smart enough to replicate what God has created. And that's the difference between the two.
Thank you, thank you. Once again, I'd like to thank you for coming out and presenting with us. As always, it's been a pleasure. And with this, we're going to wrap up, and we're going to close with our prayer. Let us pray. Dear Lord, once again, we just thank you for your Sabbath day, Lord. We thank you for my brother Mark and his wealth of information. We thank you for the information that you've given us on, that he's given us on diabetes, things we can do to prevent it, and things to do to, and just using your principles and how to control, keep this thing under control, Lord. We ask that as we leave this place that we'll have the mentality of the New Start program, the New Start acronyms, Lord, because you can't have one without the other. So we need to use all of them in the way that you intend us to use them, Lord. Please bless his family here represented here this evening. Protect us throughout the week and bring us back next Sabbath. In Jesus' name I pray, amen.